Welcome back to Rohrich Knows podcast. Well, once a year we have an incredible world-renowned meeting in Dallas, Texas. This year it's March 21st to 24th. It's the Dallas Cosmetic meeting, now in its 27th year, and the Dallas Rhinoplasty meeting, which is the global rhinoplasty meeting. It's in its 41st year. And here to help us kind of cultivate and see what's new, what's hot, is Erin McCandless, who actually does a lot of our digital media and marketing for this meeting, and she's going to ask me a series of questions that's going to really hone in on what each meeting's about. So Erin, welcome.
Thank you very much. I'm happy to be here.
So let's talk about Dallas Cosmetic.
Okay, sure. So first question I have for you about Dallas Cosmetic is, why is this meeting so different?
Well, the meeting's different because it, in a capsule, in a day and a half, tells you all that's new and what's hot and what's not in cosmetic medicine and surgery, where you have to go to other meetings where you spend 2, 3, 4, 5 days, and you don't get half of this information. And we have all the world experts, one time, one place in Big D, from breasts to facelifts to cosmetic medicine, surgery, what's the new devices, what are the new fillers, what are the neuromodulators. It's compacted into one. And today, in today's world, people want to hear the truth, and they want to hear just that and what works in their practice, unimpeded.
Right, very true. So next I have for you is it's a two-part question. First part is, what is new in the cosmetic field, and then what is hot and what is not?
Well, what's new in cosmetic medicine versus cosmetic surgery? The new things in cosmetic medicine that are new is all of the minimally and non-invasive techniques and technology. I mean, we are coming so close to getting skin tightening energy devices that actually have minimal downtime to tighten the skin, to restore collagen. You know, the biostimulators that we're going to talk about that actually stimulate collagen, and then you can also, with radiofrequency microneedling, tighten the skin. So you can stimulate the collagen, you can tighten the skin. I mean, hopefully you won't be able to replace me, but you can come very close and with no downtime. So that's what's hot in the cosmetic medicine part. And in cosmetic surgery, it's all about safety, the safety of buttock augmentations, the safety of the newer types of implants, and the refinement and all of the facelift techniques and technology. You know, we're going to talk about, is the deep plane facelift really the answer, or is it just something old that's been redefined? And we're going to talk about that with the experts. We're going to separate out what works and what doesn't work.
All right, great. So next I have, is cosmetic medicine taking over cosmetic surgery?
Absolutely. I mean, the numbers of cosmetic medicine procedures is skyrocketed, you know, even during COVID. And if you look at the plateau, the cosmetic surgery procedures are plateauing at a smaller level, but cosmetic medicine, fillers, neuromodulators, Botox, all these things have just skyrocketed because they're minimal to non-invasive, there's minimal to no downtime. So it's skyrocketed. And now the technologies that are available, many of them actually truly work. In the past, they truly did not, in my opinion, but now you actually see almost surgical results with some of these new technologies.
Definitely. Yeah, exciting stuff going on. So who are the speakers this year for Dallas Cosmetic?
Well, we'll list them, of course, and there's an amazing array, and I'll just list a few of them. You know, we have Mary Lupo, who's a world-famous dermatologist. She is, you know, she's the co-chair, along with Dave Sieber from San Francisco, who's a body contouring expert. You know, and so we've got them to spearhead the cosmetic medicine part, along with Steve Fagan, Jim Stuzin, who's a world-famous facelift surgeon, Dino Elasnia as well, who also is world famous for his minimally invasive neck rejuvenation procedures. And then we go from that to the breast surgery, where we have Jamil Ahmad and Bill Adams, a world famous breast surgeon, who's going to talk about, you know, the newest technology and techniques in that, along with Ash Ghavami, Aghavami, Jacob Unger, we've got David Hidalgo. We've got kind of a who's who in breast surgery that's coming to Dallas, and there are going to be panel interactive discussions. It's going to be very hot because we're going, they don't necessarily agree on a lot of these things, especially should we be doing submuscular, subfascial augs. And then we'll go to the body contouring arena, with of course Dan Delvecchio, Alfredo Hoyes, Ash Ghavami, Dave Sieber. These are all people that are world experts. We're going to show how you mark a patient, what do you do after you mark the patient, and then the finesse of body contouring, not only of three-dimensional sculpting, but adding fat to help further define the 3D liposculpture. So all these things are going to be demonstrated and displayed with cosmetic medicine during the first day and a half of Dallas Cosmetic and Dallas Rhino.
Wow. So next I have, let's talk about the cadaver lab for the cosmetic meeting. So why is this lab so different, and why is it so important to this meeting?
Well, the cadaver lab is the differentiator for any of the meetings that we do, because it separates out the experts from those that pretend to be, because we take the experts and take them to the cadaver lab, and they can demonstrate exactly in a hands-on manner on fresh cadavers to the participants. So this is one of the few meetings where they can not only hear it, see it, but they can do it. And they can do it with the world experts at their side saying, this is how you do it. This is how you do a BBL, a buttock augmentation. This is how you do a breast aug. This is how you do a facelift. This is how you inject fillers. We're going to have live demos of all of these things, this new technology. So you can hear it, see it, feel it, and do it. Only at Dallas Cosmetic.
Definitely. So what are the top 3 things you would say that attendees can learn at Dallas Cosmetic?
I think the top 3 things that you will take home is not only what works and what doesn't work, but what things and what devices are worth potentially purchasing and that really have an ROI, not only for the patient, but also for your practice. And number 3, it's all about safety and outcomes. Can you leave this meeting and be safer and have better outcomes? The answer to all 3 has to be yes, especially the one on safety and outcomes. Because after all, we're physicians first, not plastic surgeons or dermatologists. We care about our patients. It's always about the Hippocratic Oath, do no harm.
Mm-hmm. Okay, so let's talk a little bit about the panels that are happening at this meeting. Can you list some of the panels, some topics they'll be discussing?
Well, the hot panels are going to be about, in cosmetic medicine, they're going to talk about what are the technologies that they use today that not only have give you great outcomes, but also things that people enjoy doing and look better. So we'll be talking whether it's the new Morpheus, the new types of non-invasive technology, soft wave, and all of these other techniques that actually do work. And then we'll do live demos too of all the new fillers that have the new indications, and we'll do use the biostimulators, Sculptra, and also Radius, and talk about how to inject them, where to inject them. So it's going to be live, interactive, and then the panels will discuss, what really matters, what really works, and it's really the array of all of these experts that are going to talk about these techniques and technologies. And then we'll have a social media panel with a lot of the influencers talk about really what they can do to enhance not only their patient care, but their practice as well. So it's very practical and down to earth. And then, of course, in the body contouring and breast ones, we're going to have a live interactive panels, which is probably the best part of the meeting, because there'll be a titan clash between all of the giants in breast and body, and they don't always agree, but they respect each other, and the end result is always excellent. But there are many different ways to get to an excellent result.
Mm-hmm. For sure. So let's talk about the live demos. What are some of the live demos that will be taking place?
Well, we're going to be doing, the highlight is always the live demos of the fillers and the new neuromodulators that we're going to be doing, and and then the biostimulators, which will be Sculptra and Radius. And so we'll be introducing a lot of these new techniques and new technologies, and we'll have the world experts there doing them. You know, whether it's Mary Lupo or Steve Fagan, they will be showing us what works, where it doesn't work, how to inject a tear trough filler, and when to do it, when not to do it, and all of these techniques. And I think that's going to be very exciting because things change and techniques change and technology changes, and you have to be at the cutting edge to make sure you give patients best care.
Mm-hmm. Okay. How about the industry aspect of the meeting? Can you tell us about the industry leaders we can meet?
Well, you can meet the industry leaders from, InMode Technology, Softwave, Allergan, Mentor, Sientra, and I think a lot of the skincare companies from Zeo and Revision Skincare will be there, and I hope I don't miss any of them. But the other thing is we'll have other new technologies from Galderma and MERS, as well as Evolus, which has an incredible neuromodulator, Juvo. They'll all be demonstrated live. They all have little nuances that are different. And of course, in the surgery section, there'll be Microns and several of the book companies from LWW to Thema, and we'll be highlighting our new books, especially the new book on Dallas Rhino and the Masters of Cosmetic Surgery. So it's just exciting. And the greatest thing about this meeting is that they'll have an opportunity to meet with the industry leaders and the industry vendors right there. We give you lots of time to meet with them and talk to them about their techniques and technologies. And we'll also have several different social media groups that'll be there that will be able to be that can help them in promoting their practice. So it's really a one-stop shopping meeting.
For sure. Okay, so last but not least, I want to ask you, who should attend this meeting and why?
I think anyone who's an aesthetic provider, whether you're a dermatologist, facial plastic surgeon, oculoplastic surgeon, I think this is the meeting for you. One stop, one time, one place. You can see it all. You can capture it all. And our goal here is to make sure you get the right information about all of these things, and you get it at the meeting. Well, that's a brief capsule of what we're going to be doing, seeing, hearing at Dallas Cosmetic this year, March 21st to 24th. Join us in Big D to become a better you.